Medication errors are a recurrent issue in the hospital setting that can cause preventable harm to patients. According to the Washington Post, researchers have found that medical errors are now the third leading cause of death in the United States. Therefore, it is more important than ever that medication reconciliation is taken seriously. Before we discuss the importance of medication reconciliation, let's review some background information. According to the U.S. Department of Health and Human Services, patients who experience an adverse drug event account for 700,000 visits to the emergency department and 100,000 hospitalizations per year. Approximately 5% of hospitalized patients are impacted by medication errors, making it one of the most common inpatient errors in the healthcare setting. So what is medication reconciliation? Medication reconciliation is a process that is done in attempts to cut down on medication errors in all settings. Patient safety is a priority. A collaborative effort is needed among physicians, pharmacists, and nurses to reduce medication errors through improving the process of medication reconciliation. Therefore, a group of students from AZUSA Pacific University have gathered to address the issue of medication reconciliation. Using the Plan, Do, Study, Act model for improvement, they developed a precise project for improvement that can be applied and implemented in the healthcare setting. Therefore, this presentation will be a summarized, systematic breakdown of the change project to be implemented. An analysis of the process of medication reconciliation was performed using 4 quality performance tools. These included the medication reconciliation flowchart, run control diagram, fishbone cause and effect diagram, and the Gantt chart. Using these 4 tools provided a diverse approach of analysis that paved the foundations for this change project geared towards improving the process of medication reconciliation. A medication reconciliation flowchart was used to outline a safe and correct way to complete the process of medication reconciliation in a clinical scenario. This flowchart identifies several steps of the medication reconciliation process. The patient first enters the medical facility. The nurse then asks the patient of his or her current or past medications taken at home. These include prescribed medications, over-the-counter, herbal supplements, or any street drugs. The nurse also clarifies if the patient has any allergies. The nurse then reviews the patient's medication orders and compares the current and past medications taken at home. Before medication administration, the nurse reviews all of this material. If there are any problems or any potential adverse interactions, the nurse then notifies the physician or pharmacist to verify if the order was intentional or not. If it was intentional, the nurse would then document this and proceed with medication administration using the 5 rights. If this was not intentional, the nurse would then reconcile with the physician and pharmacist to correct the issue. Once correct, the nurse can proceed with medication administration using the 5 rights. If there are no problems found when the nurse reviews medication orders, then no action is necessary and the nurse can proceed with medication administration using the 5 rights, then documenting that. After giving any medication, the nurse would monitor the patient to see if the medication was effective or not. This concludes the analysis of this flowchart. A fishbone cause and effect diagram was used to identify several categories and problems that may occur in the healthcare system regarding medication errors and medication reconciliation. These problems have been placed into 4 broad umbrellas in this diagram. These problems include number 1, inadequacies in the medication management process. Number 2, the lack of materials and resources needed to provide adequate safety. Number 3, environmental impacts. And number 4, the imperfections of manpower. This systematic breakdown acknowledges the different areas that are necessary for change and improvement. In this project, a run control chart was used to evaluate different variations of data points over time to give a comprehensive picture of a single variable. In this case, data was collected to examine the efficiency of medication reconciliation done per shift between nurses and pharmacists in the hospital setting. In summary, we recognize that key ingredients for successful medication reconciliation during each hospital shift include effective communication and follow-up between nurses and pharmacists, active involvement by management in enforcing policies in both day and night shifts, and positive attitudes by the staff. This run control chart helped identify several ingredients of change that can improve the process of medication reconciliation during a hospital shift. The Gantt chart was used to illustrate our timeline of our project schedule. It shows the starting and finishing time of each element. The schedule was modified based on clinical setting. First, we identify the research problem, which takes approximately 1 to 2 weeks. We then come up with a project and plan in week 3. After we develop a project and plan, we take the first 2 months to meet with managers. Managers meet with charge nurses. We develop a budget and obtain approval. We establish adequate staff. Then we train nurses and in-service staff. During the 3 to 6 month period, we implement the new standard policy for medication reconciliation. We also observe the nurses and the implementation of this new policy protocol. We collect data from the moment the policy is implemented. After 12 months of implementation, we then analyze the data and calculate statistical significance to reduce erroneous medication reconciliation errors. We take all the data collected and evaluate whether there is a need for any more improvements. Using the Plan, Do, Study, Act model for change, we aim to decrease the number of incomplete or erroneous medical reconciliation attempts. During our planning phase, we aim to create an adequate policy regarding staffing, an incentive program, and address our goal, which is to have 75% of staff members following the new policy protocols within 1 week and to have 100% of staff members following the policy within 2 months of the initial implementation. During the due phase of this cycle, we calculated that it should take approximately 1 week for the new policy to be implemented into daily practice. Managers will continually observe and monitor that the policy has been implemented properly. They will also observe for a decrease in the number of incomplete or erroneous medication reconciliations. Managers will be encouraged to discuss gaps of implementation with charge nurses so that the charge nurse may assist the nurses on the floor of any misunderstandings or any questions that they might have. During our study phase, after 1 week of data collection, we plan that the results will be compared to the goals set forth within the plan. If the percentages of participation are lower than the goals within the time limits, feedback and interviews will be conducted with various staff members to attempt to isolate why non-compliance occurred. During our ACT phase, based on the gathered data, managers will monitor and evaluate the results. There will be an ongoing staff education regarding the importance of proper medication reconciliation in the continuum of care. Weekly meetings will be conducted in order to monitor the medication reconciliation compliance in all shifts. During these meetings, there will be recommendations for changes, corrective actions for continued errors, and evaluation of effective strategies. If the proposed plan is not successful, implementation of new plans will take place for improvement opportunity and the PDSA cycle will be repeated. The aim will be to propose new strategies to sustain quality practice and maintain patient safety. One aspect of this project that would prove difficult will be relying on staff to embrace change. Creating incentives and strategies that address this issue will be necessary to make sure that all staff understand the importance for this change. Staff attitudes will need to be shifted to promote a positive environment for change. Barriers of change will need to be addressed, and staff's concerns should be heard. Recommendations for change include involving the team as a whole and delegating team comprehension. In our Plan, Do, Study, Act model, nursing managers are responsible for ensuring that nurses on the floor are comprehending and implementing appropriate facets of our plan. Nursing managers should be able to identify non-compliance of the staff and undergo corrective actions and implement effective strategies for change. By the end of this project, we hope to have 100% understanding and compliance with implementation from staff. IHI stands for the Institute for Healthcare Improvement. They are an organization that drives healthcare improvement across the world. In this project, we will use the auditing tool called the Improvement Tracker provided by the IHI website. This measuring tool requires hospitals to conduct a random sample of patients to collect the total number of unintentional medication discrepancies. A gold standard medication history is collected by a licensed pharmacist at admission to determine what medications a patient is taking prior to admission into the hospital. The pharmacist can then utilize a medication checklist that ensures all aspects of medication reconciliation are met and verified. To identify discrepancies in medication reconciliation, the gold standard medication history will be compared with the medications received during admission and prescribed at discharge. Random sample audits will look closely at route, dose, and frequency consistency amongst the gold standard medication history list. Audits will also examine the medication administered throughout the patient's care. Results can be shared with nurses, pharmacists, and physicians to allow them to note progress over time. Measuring provider compliance with medication reconciliation is contingent on providers attesting to its completion. Quality auditing report systems can provide reports and run charts that assist in developing action plans and tracking progress. This is the measuring tool that will be used for this project. In conclusion, improving the way that medications are being managed and administered is not only beneficial for patients, but for healthcare systems and hospitals as a whole. Less medical errors increase the likelihood of patient recovery, thus allowing hospitals to conserve resources, as complications may lead to more extended recovery periods and hospital stays. However, this benefit should not negate that patient safety is the number one priority. It is the duty of all healthcare professionals to engage in innovative ways that will combat the problems of medication errors and improper reconciliation. As healthcare systems strive to improve the issues of medication reconciliation and medication errors, this project for improvement will be a valuable tool.